Hello, Dr. Walid. I'm one of the doctors in this facility today. Am I speaking to Mr. John, who is 60 years old?
Yes, doctor.
Mr. John, we are here to discuss about your condition today. I'll be asking you a few questions, following which I will be examining you. Is that okay with you?
Okay, doctor.
During our discussion, I will be taking down few notes. Be sure that they will be confidential.
Okay, doctor.
I gather from your notes that you are having vision loss. Is that correct?
Yes, doctor, you're right.
Can you tell me more about it?
Yes, doctor, I was all right. Yesterday night I slept very well, but today morning when I get up from my sleep, I was thinking my vision was blur on the right side. Then I went to washroom and wash my face, and after that, I was not able to see the object from the right of my eye. I just closed my left eye, and I was totally blind at that time. So it was so disturbing for me. I called to my wife, and she immediately called to ambulance, and we came to the emergency department. And while coming to the emergency department, it got settled, and at the moment I can see normally, and nothing, not a problem for me. I want to know what happened to me at that time.
This must be a difficult time for you, Mr. John. I will try my best to sort it out for you and help you in this regard.
Thank you, doctor.
Before we proceed further, may I know if you have any long-term medical illness that you have been diagnosed of?
Yes, doctor. I'm having high blood sugar for last 10 years, and I'm having high blood pressure for last for 6 years, and I'm also taking medicine, few medicine for high cholesterol level also.
Can you tell me what medications? Can you show me your drug list, please?
Yes, I can. I'm managing my diabetes with this Lispro and Glargine, and for the hypertension, I'm taking the lisinopril 5 milligram, and high cholesterol level, I'm taking Zocor 40 milligram.
Okay, Mr. John, coming back to your primary complaint, you said you were having vision loss. So, this started suddenly, right?
Yeah, it was certain, doctor.
And when you had vision loss, was it complete loss of vision or it was blurriness?
Yes, it was a complete. Initially, it started with the blurriness. Then after that, it's completely my eyesight was diminished, absent even.
Okay, okay. And it was only one eye, you said.
Yes, doctor, right side.
Okay. And when it started, it came off after how much time, you said?
30 minutes.
30 minutes. Is this the first time you had this?
Yes, doctor, it was first time.
Okay, okay. And did you have any pain in your eyes?
No, doctor.
Yeah, did you notice any redness,
No.
any discharge from the eyes, any tear,
No,
any water from the eyes or anything?
no, doctor.
Okay. Mr. John, I would like to know that have you checked your blood sugar control in the last few months? Is it controlled?
Yes, doctor. My 3 month blood test was 7.2.
And what about your blood pressure?
Blood pressure is always under control. I'm taking care of my medications, and I'm exercising regularly, so it's remain within 130, 140, or 90, sometime 92, 93.
Okay. Okay, Mr. John, I'd like to know if you have any loss of consciousness. Hello.
No,
Any raised body temperatures?
no, no, doctor.
Any difficulty in walking or swaying?
No,
Any headaches?
no,
Okay. Any shaking of the any part of the body?
no headaches.
Any weakness in any part of the body?
No,
Any abnormal sensations?
no,
How about your mood?
no abnormal sensations. Mood is fine, doctor.
Any changes in your memory?
No,
Okay. During this period, did you lose any control over your bowel work or bladder works? Water works?
No,
Okay. At this time, did anybody check your blood sugar?
no. Yeah, blood sugar. My wife checked at that time. It was 6.5.
Okay. All right. Did you during this period did you have any increased sweating?
No,
All right. Did you have any throw up?
no, doctor.
Okay. Any racing of the heart?
No,
Any breathing difficulty?
no,
Any chest pain?
no chest pain.
Okay. Did you have any clots in your legs before?
No, doctor.
Any history of any clots anywhere in the body in the past?
No,
Do you have any pain in your jaws when you chew?
no.
Okay. Do you how about your water works, Mr. John?
Water works are fine, doctor.
Okay. Any weight changes?
No weight changes.
Any weather preferences?
No,
Any appetite change?
no, doctor.
Any fatigue?
No,
Any itching over the body?
no,
Any rash?
no rash.
Any joint pains?
No joint pains.
Any pain in your shoulders or your back?
No,
Any difficulty getting up from chair?
no,
Any difficulty combing your hair?
no.
Okay. Mr. John, I would like to ask you a few personal questions.
Yes, doctor.
Do you smoke?
No, doctor.
And do you drink alcohol?
No,
Do you take any illicit drugs?
no,
Mr. John, any history of any similar condition in your family?
no, doctor.
History of clots in the blood channels in the family?
No,
Okay. Are you working, Mr. John?
no, doctor. I'm retired army officer.
All right. Okay. How about your social life? Is it affecting your how you're coming up at home?
I'm doing well, doctor. I can manage my daily life, but this episode, put me on the backside. No, I'm afraid maybe this will happen again, and I will completely, lost my vision.
So, do you need any help?
No, doctor. I have sufficient help available.
Do you drive?
Yes, doctor. I do drive.
Mr. John, at the moment, I will advise you to stop driving, and we will get back to you regarding this after we know what is going on.
Okay, doctor.
Okay. I would like to examine you now.
Yes, doctor. You can examine.
Okay, I will start with the eyes to check for visual acuity.
Visual acuity is fine.
I will check the extraocular movements,
Normal,
pupils.
normal.
Okay, and for your visual fields.
Visual field is normal.
Okay. I would like to any facial asymmetry.
No,
Okay, I would like to check for any temporal tenderness.
no temporal tenderness.
Okay, I would like to offer for fundoscopy.
Normal,
Okay, I want to check for uh, cerebellar signs in the upper limb,
negative,
pronator drift.
negative.
Okay, I would like to auscultate the heart.
You can see S1, S2, and there's no added sound.
Any murmur?
No,
I would like to auscultate the carotid as well.
normal. There's no bruit.
I will check the hands for any pinprick marks.
Yes, patient is having pinprick because he's checking his sugar levels.
What about the pulse?
Pulse is regular, 90 beats per minute.
Radiolateral delay?
No delay.
Any? What about the blood pressure at the moment?
Blood pressure is 140 or 90.
Any postural drop?
No postal drop.
I would like to examine for proximal myopathy.
Negative.
Okay. Okay. And lastly, I will check. I want to see the gait of the patient
Gait is fine.
and plantar as well.
Planters are downgoing.
Okay. Okay, Mr. John. What are your concerns?
Yes, doctor, what's going on with me? Why I have this episode today?
Yes, Mr. John. Based on your history and physical examination, there are a couple of conditions in my mind. Most likely, you are having what we call as a mini stroke. I'm sorry for the medical term, which means that there could be a clot in one of the blood channels supplying the eyes, because of which you
Mhm.
had this issue. So what we're going to do is we will admit you now, and we will do some tests and scans.
Okay.
Most likely, you will be treated by a team of doctors, which will include a brain doctor, an eye doctor.
Doctor, will it come again?
It is early to say, Mr. John, but there is a possibility. So we need to run the scans and tests so that we can address his concern better.
Will I need any surgery, doctor?
It is early to say, Mr. John. It will depend upon your scans, but at the moment it seems unlikely.
Okay. Okay, doctor.
Any other concerns?
No, doctor. What I'm interested that it will affect my daily livings or not.
Well, with proper management and follow up, you will have a good quality of life, Mr. John.
Is something in my eyes, doctor, or something in my brain?
But at the moment, it seems unlikely, but we will definitely be ruling it out.
Okay. Thank you, doctor. Dr. Walid, you have 1 minute 30 seconds if you want to add anything.
Any previous surgical history? I forgot to elicit that actually.
No. You are missing very important question.
Any jerky movements of the hands or legs?
No. You have 50 seconds if you want to see anything else.
Any trauma to the head?
No, doctor, no trauma to the head. Wonderful, Dr. Walid. That must be a first question, but
Yeah.
it's not late. Okay, Dr. Walid, you can close your case. You can summarize up.
Yeah. I have examined Mr. John, who's 60 years of age, who presented with unilateral vision loss mainly in the right eye, which started last night. Which is gradual in nature, ultimately leading to complete visual loss. Patient is a known case of diabetes, hypertension, and dyslipidemia since past 10 years on Lispro and Glargine for diabetes, on hypertension, on lisinopril and Zocor for dyslipidemia. Patient had complete resolution of the vision loss after around 30 minutes. On examination, patient has pinprick marks on his fingers. Apart from that, I could not elicit BP. Blood pressure is 140/90, pulse rate is 80, and there is no. It's regular with no radial delay. Apart from this, I could not elicit any significant physical finding.
Okay.
So my differential is most likely this could be a transient ischemic attack,
Okay.
and
What else?
I would like to keep other differentials like retinal migraine.
Okay.
Uh, I would also like to keep any thromboembolic conditions, but at the
Okay.
moment I could not appreciate any risk factors.
Okay. Well done. What else it could be?
Down the list, I would like to keep temporal arteritis, but again, I did not appreciate any headaches or temporal tenderness.
Well done. Okay. So how you're going to investigate this case?
Apart from baseline investigations, which will include complete blood count and liver function tests and renal function test, I would like to do blood sugar of the patient with HbA1c. I would like to repeat the lipid profile along with urine complete examination for proteinuria and glucose in the urine.
Mm-hmm.
I would like to do an MRI brain,
Okay.
and I would like to do an ECG of the patient with
Okay.
carotid Doppler,
Mm-hmm.
and um,
Moving.
if I would also like to do inflammatory markers like ESR, CRP.
Very nice. Okay. Is there any need of MRI orbit also?
Yes, the complete MRI brain and orbits.
Okay. So how you're going to manage this case?
Uh, Non-pharmaceutical management on the lines of patient education and counseling, advising a patient to keep proper, nutritional support to keep um, the diabetes under check, and salt restriction and sugar restriction, and
Mm-hmm.
forming a multidisciplinary team which will include an ophthalmologist, a neurologist. Um, Pharmaceutical management will depend if this is a transient ischemic attack. After a CT scan excludes bleed, we can start the patient on antiplatelets and good blood pressure control and good diabetes control.
Okay, Dr. Walid. Is there anything else you want to add in this case? Could it be hypoglycemia or not?
I asked for the blood sugar at that moment, but the blood sugar was normal, so I ruled it out actually.
Could it be or not?
Yeah, it is a possibility.
There's possibility.
It is a possibility.
Okay. Okay, Dr. Walid. Okay. Thank you, Dr. Walid.
Okay.
So wonderful, Dr. Walid. Perfect. Ideal, demonstration of transit vision loss, history and the case interpretation, that demonstration of the excellent, from your side. This was a transit vision loss, and it is coming again and again in the exam. Recent, right? The patient was young 2 days before it came in, I think, in Bahrain. So that patient was a young patient. If this patient is a young and he's having transit vision loss, what do you think? What are the differential diagnoses then?
Then I would like to I would like to keep the thrombophilia at the top, and I would like to do a thrombophilia screen for the patient.
Hmm.
Also,
What else?
I would elicit history for any seizures to look for Todd's paralysis.
Okay. What else?
And
Most common.
most common, it could be a migraine, a retinal migraine.
Hmm. Very nice. Very nice. Okay, Dr. Walid. Wonderful. So, Dr. Walid, I have nothing to add in your case because that's a perfect thing. What you have done so far, there is a I cannot add lot of things in your presentation. You were missing a few questions that must be on the top. That was a trauma to the head, but you miss and you just remembered that question, and you have asked the patient that did you have any head trauma in the recent past. So physical examination, yes, I'm going to give you full marks because there is nothing to add in the physical examination. Did you check the bitemporal hemianopy or not?
I asked you visual fields.
Okay, well done. So physical signs, there is no obvious physical sign in this case, and you're not going to cook any physical signs. So if you are going to cook any physical sign, I'm keeping you the borderline. But in your case, you are going to be a satisfactory 4/4 clinical communication skills. Yes, very right. Your introduction was good, mashallah, and you opened your case in a good professional manner. So after OD-para, you picked up, you come to the local associated questions. So local here, the organ is eye. So you ask about the redness, lacrimation, discharge, any pain and swelling. And then it's connected to the CNS that you screen all the questions, apart from few questions that difficulty in speech and swallowing. That is a part of also neurological questions. You could ask because the patient is having TIA or stroke. So this is the first presenting complaint, dysarthria, difficulty in speech. So you can add few more questions. Otherwise, it was a perfect. Then you ask about the cardiovascular risk factors, the respiratory risk factors, any cough, any maybe there is secondaries in the brain. So temporal arteritis, chewing, and any tenderness and any pain in while walking or not. Then thrombophilia, any blood channels, any clots in the blood channels, any recent medication are you taking, and you see doubles or not. So then wafers, yes. After that, impact, smoking, alcohol, family history of clots, a similar condition, or any other condition. Okay, what do you do for living? He's a retired army officer. He's not doing anything. You are offering the social help. Wonderful. You are stopping the driving. Wonderful. You are going to admit this case. Then you are taking involving the multidisciplinary team, including the brain doctor, to look further into details. Coming to the examination, yes, you're right. So you start from the face. It's up to you. Eyes, as the extraocular movement, pupils, then flaccid, facial asymmetry or not, then tenderness, temporal, occipital tenderness is a part of that also. So occipital tenderness and same scheme like headache scheme. You can apply over here. Then fundoscopy. Then you are going for the cerebral and pronated drift, cardiovascular examination, and the pulses is very important in this case. You check the pulses, proximal myopathy, gait, and everything. So your demonstration of this today, the first concern was also brilliant. So what's going on with me, doctor? So based on your history examination, Mr. John, I have a few things in mind. Most likely, we are called it's a mini stroke. Sorry for the medical terminology. It's when the blood supply to the brain become decreased. It's either because of the blockage or it's a reduced volume in the blood. So it can cause a lot of problems similar to your condition. Okay. What we're going to do now, we're going to admit you and we're going to run some blood tests and scans of your body. When the scan will be available, we will sit together and make a management plan with you. Most likely, you will be treated by a brain doctor and nerve doctor and eye doctor. Well done. So will it come again? Yes, there are highly chances. If one there is a anyone having the first episode, there is chances. So we need to look for the cause. What is causing the problem? As long as we are not aware of that, there is a higher possibility that you may get this episode again. So will I get better? Yes, very right. Your concern you have addressed with the proper management and regular follow-up and with the diagnosis. Your quality of life will be improved. It's very early to say what's going on in your case. So very well done. Then coming to the differential diagnosis, yes, differential diagnosis, you can put trick in all young or old. That will save your life. If old age, triple T at the top, trauma to the head, TIA, and temporal arteritis. Three T's. If the young, you can add trick, thrombophilia at the top, retinal migraine, I for idiopathic intracranial hypertension, C for cardiovascular abnormalities, and S for seizure like throat paralysis. So these are, if you add the very important cause over here is a metabolic cause, that is hypoglycemia. You need to rule out in any case of TIA, even a stroke, you need to check the blood sugar level at that time. So clinical judgment, yes, you are very right. Said few investigation that are the backbone of this clinical consultation of TIA stroke or transient vision loss. That is CT, MRI brain, CT angiogram if indicated, MRI orbit coming down to the carotid Dopplers, then ECG, echocardiography, then blood screen. Apart from that, apart from the baseline, the thrombophilia screen. That's very important. And any other abnormality, if there you're suspecting some, temporal arteritis, you're going for the biopsy, temporal biopsy. You can add CBC to look for the ESR again. Management plan, yes, the four-step management for every case of TIA and stroke. What are the four-step management? Patient education, counseling, lifestyle modification. If the patient is ruled out bleed, you can start aspirin, antihypertensive in any case of TIA. Regardless of this, even blood pressure, you can start the plindopril that is indicated. Even the any case of TIA, you can start. It will be the prophylactic medication for his prophylaxis of recurrence of TIA. Then statins, very well done. So he's going to start the statins. Then next, rest of the treatment will be according to the cause. If the patient is having temporal arteritis, we are going to give him steroids. If migraine, we are going to treat the migraine. If epilepsy to anti-epileptic, we are going to give him. If thrombophilia, yes, we are putting him on long-term anticoagulation, and we will take, and he will be under care of the hematologist. If idiopathic intracranial hypertension, then the treatment will be the same as the astazolamide or recurrent lumbar puncture, or there is a shunting. Where went to the peritoneal shunting, and other is where one is VP shunting, and second, which shunt is the other shunt, Dr. Walid, for idiopathic intracranial hypertension.
Ventricle validation shunt and
And
something. Uh,
Dr. Dr. Kurat will
yeah,
guide us.
I thought recollect.
Okay, so I will see and such, and I'll give you the this second shunt. Uh, I skipped from my mind. If someone knows, he can add. So, dear doctor, this was a case of unilateral vision loss and transit vision loss. Recently, 2 days before this long clinical consultation was a transit vision loss in a young. So, be aware that any clinical consultation can come in your exam. So, you must be ready for any type of the cases. So, once dealing with the unilateral vision loss, then you can just follow the scheme of like this. You can ask the questions, especially if you're opening your case after introduction, after past medical history. OD para, onset, duration, progression, and P for pattern. The second P is a pattern. Pattern is a wonder. Wonder stands for what? Wonder is what do you mean of your vision loss? It's a part of any visual field. It's a complete. O for one eye or two eye. N for near vision or far vision. D for direction, in which direction. If you have any vision loss, is specific direction, up and down, lateral side, medial side. Okay. E for exercise related, any double vision, because you may find a case of double vision. Double vision in different things. Sorry. Uh, E for exercise related, is it something related to exercise or not? Because if the patient is having a problem with this MS, you can keep in even MS in your differential diagnosis, Dr. Walid. Then R for related symptoms, means redness, watery eyes, or any discharge or not. If the patient is young, yes, you are going with the tricks. T for thrombophilia, R for retinal migraine, I for idiopathic intracranial hypertension, C for cardiovascular abnormality, especially atrial fibrillation, and S for seizure. Post seizure, if patient is having transient vision loss, so it's a total paralysis. These are the most common causes in young, and for the old age, triple T. Think about if the patient is having on the background of diabetes, hypertension. So thrombophilia at the top, again, temporal arteritis and TIA. And most important thing, which is not mentioned in the slide, is hypoglycemia. After associated local question, that is eye redness, we have discussed. CNS question must be, you need to screen every part of the brain from starting from the posterior fossa, then the anterior fossa, the middle area, and the temporal area. So we know how to screen those questions, then impact on job, social life, driving, and stop driving for 1 month if the patient is having seizures and even a transient vision loss. You can ask the patient to stop vision because TIA is a transient vision loss is equal to TIA. So for that reason, we can stop. If you don't know, if you're not sure, then refer him for DVLA. That's very important. So, admit the patient for workup and examination scheme is inspection, temporal palpation, neck stiffness, eye for visual acuity, color field, and extraocular movements, offer fundoscopy, cerebral sign examination, finger nose test, pronator drifts, cardiovascular examination, carotid body planters, and gait. These are the minimum examination scheme. Then workup, MRI brain, carotid Doppler, ECG echo, and thrombophlebitis screen, apart from the baseline investigation. Management, we have discussed a few minutes before. So this is what we need to do in exams. You may expect, though this might be your case in exam. So every case is your case. Don't close your brain that if I'm not doing the case, so this case cannot come to me. No, you may face this case anytime. So any question from anyone? Wonderful, Dr. Walid.
I'm Dr. Sima, one of the doctor in this clinic. Am I talking to Miss Maria, 30 years of age?
Yes, doctor.
Miss Maria, today we will discuss about your health condition. Is that okay with you?
Okay, doctor.
Miss Maria, what do you know about your condition so far?
Yes, doctor. I have this problem, of my joints for a long time. It's almost 6 years now, and suffering with this pains. And I was taking the medicines, since 5 years. And I was on the regular follow-ups, but I lost the follow-up because of my mother's illness. And now I thought that it has progressed to another, way, and I'm not able to cope up with my hands. And I visited to your seniors. They asked me to do the some blood tests, but because they were about to start a new medicines for this my joint pains. So I'm here today to collect my blood reports. I want to know what's going on with me.
And what are your expectations from this meeting, Miss Maria?
Really, doctor, I don't know because a lot of things in my life is going on. I'm not uh, able to think about what is going on with me because my disease is I think this I have an advanced disease. This must be something serious in my body. And tell me what about the my scans of my chest also? What is the report?
Okay, Miss Maria, as you told that you have complained of joint pain for last few years, and you have missed some appointment due to some personal issues, and no, you are for the control of your pain of your joint. We were planning to start you on some new medicine. Before starting this medicine, we done some test, that is X-ray of your chest and some other tests, blood tests, to see if you have any underlying bug infection that is causing tuberculosis.
Mhm.
So the chest X-ray is normal, but the other blood test is showing that you have infection, a bug infection of known as latent tuberculosis.
Which tuberculosis, doctor?
Have you ever heard of this latent tuberculosis?
No, no, doctor. What do you mean by latent tuberculosis? Is this
Uh,
bug infection in my body?
yes, Ms. Maria, it's a bug infection that is present in the body that is causing no symptoms. That is causing no problem in your body, and it is not causing any symptom like cough and high days body temperature and weight loss, but it is present in your body. But if we start other medicine for your joint pain, it can flare up the bug infection. So we have to treat this infection before going to the other medicine.
But doctor, so you surprised me. From where did I get this infection, bug infection of this tuberculosis? I don't have any problem at the time. I don't have any cough and body temperature, or night sweats, which was experienced in such patients.
Um, uh, Miss Maria, I appreciate your concern. It is the bug infection that causes no symptoms. Like as you mentioned that you have no symptoms at this time, no cough, no raised body temperature, no symptom of weight loss. Sometimes there is exposure to this bug infection. Have you ever
Mhm.
anyone in your family who has some bug infection, like tuberculosis infection in your family?
Yeah, doctor, I told you that my mother is sick and she is having tuberculosis. I'm taking care of, her. I'm the only one who is caretaker of my mother, and that's why I have missed appointments with my GP also. So you want to say that I might get this infection from my mother, right?
Yes, there is a chance that you have this infection from your mother. So, no, we will treat you with some medication so that we will start you on some other drug for the control of your joint pain.
But
Are you?
doctor, you want to say that you are going to start new medication to me, right?
Yes,
And
it's
it's
for
so
the better.
surprising for me. If this bug infection is not causing any problem in my body, then why are you going to start medicine to me?
Miss, yeah, if we don't treat this bug infection, that it can cause a lot of problem. Like it can cause symptoms. It can cause problem like fever, weight loss, and it can become active, and even it can spread to the other organ of the body, and it can even affect your lung. You can have even breathing problem, even you can have lung failure, even it can cause death of the patient. So it's better we treat you before starting the other medicine.
And what about my joint pain, doctor? About new medicines? Because I am not able to, cope up with my daily life right now. I'm struggling with the daily house chores. Nobody's helping me at that at that time. I need to take care of my children. I need to take care of my mother. And if you are not going to start medicine for this joint pain, then how I will manage my life, doctor?
Miss Maria, I highly appreciate your concern, but we have to treat this infection before starting this other medicine. But we will involve the joint doctor. They will keep you on other medicine to control the pain of your joint, and as well we will involve the social health worker. They will help you in this regard. You have difficulty in doing daily activity daily activities at home, and right now I will involve the uh, joint doctor. They will evaluate and give you treatment accordingly for the control of your joint pain.
And is it possible to receive both of the treatments all together?
Miss Amalia, we have to start the treatment of bug infection before starting this other drug. If we start it, so it can cause symptoms, and it can activate your infection, and it can cause problem for you. So it's better we will treat this infection before starting other drug.
Why? What happened in the body? Why this new medicines will activate this bug? What is the problem with that?
Miss Maria, it will this infection will suppress the defense system of the body. So
This drug or
as
the infection?
this drug will the new drug we are planning to start for your joint pain. Basically we plan our plan is to suppress your defense system, and when this drug suppress your
Mhm.
defense system, it will activate the underlying infection, bug infection. So it's better we would
Two
treat it
minutes left.
before.
But doctor, if you are going to isolate me, because if you are going to give a separate room for me, and it's not easy for me because I need to take care of my children. I told you before, so I need isolation again, as my mother had isolated.
Ms. Maria, in this infection, this type of latent bug infection does not spread to others, so there is no need of isolation. So yeah, you have to take medicine and it. regular basis. Are you getting it?
Okay. Yeah, doctor. And for how long you're going to give me this medicine?
Um, for this, we will involve the birth doctor, and for if we are giving you two drugs, then it will be given for 3 months, and if we are giving you one drug, it will be for 6 months. And we will involve the bug doctor. They will give you medicine, and this medicine has some side effect, but these side effects are minimal, and we will keep you under observation for your joint pain as well as for the side effect of this drug. It's okay with you?
Okay, doctor.
Do you have
Yeah,
any other
doctor. Okay,
concern?
thank you. You have cleared my mind now. No, doctor. And when you are going to start this?
We will start you give you medicine today, and so that your treatment started now. And I will provide you some website
Up,
and brochures so you can read about your disease in detail.
time up.
And if you have any problem, you can contact us at our hospital number. Do you have
Okay,
any other concern?
doctor. Okay. Thank you, doctor. No, doctor. Thank you so much. Everything is clear so far. So, Dr. Simab, wonderful, Dr. Simab. Very nice. This case is always very difficult because in this case, the
So your
problem
voice
is
is not audible.
concerns. There are a lot of concerns are there. Can you hear me? What do you think? How was your performance? Okay, dear
I'm
doctor. So,
missing some.
uh-huh.
Few
You
when
are
you
you're
asked few
miss.
questions, I able to recall that I should have mentioned this before.
No problem, no problem at all. If you're not mentioning, the surrogate is there. He will help you. Don't worry about that. In real exam, even they are helping a lot. So, mashallah, you did a great job. I'm going to give you 15 by 16. I'm going to cut your 1 mark of this latent tuberculosis, although the examiner will not cut this mark from your side. So the clinical communication skills, yes, clinical explaining the information and management of option in a clear, structured, and comprehensive and professional manner. Very nice, Dr. Sima. Wonderful job. Then assess the impact of symptoms and identify patient preferred management plan. Okay, how that sounds to you? Is that okay with you? So you are with the surrogate. So satisfactory for before clinical judgment, yes, very nice. So you appropriate and accurate clinical knowledge. Yes, you have a good knowledge about this latent tuberculosis. That is not activate. That is asymptomatic. That is, not spread from person to person. So there is no need of isolation. Duration of treatment was awesome. And the moreover, I was suspecting that that time that you may miss the side effect, but you have covered the side effect also. So absolutely wonderful. Everything was covered there. So managing patient concern, yes, very well done. So why you are not going to start this medicine together? Very well done. So this new medicine known as a biologic medicine, known as biologic, they can suppress your defense system. Once the defense system will be suppressed, they may get activated and they can cause problem in your body. So it's a need that we should avoid those medicine at the time. So then how I'm going are you going to manage my joint pains if you're not going to start new medicine? This was the only last medicine for me, the doctor told me before, and you're not going to start with this medicine. That will be problematic for me. That was a concern. You said very well. So we are going to involve the joint doctor and they will take care of your joint problems, and we will monitor your condition very closely. Okay. So what was the other concern? What is the latent tuberculosis? Very well done. Are you going to isolate me again like my mother. Yes, you said very well. So these are the sleepy bugs. They do not need any isolation as they cannot spread from person to person. But meanwhile, just safety netting. For the precautions, you can use a mask when you are in a gathering, when you're with the family members. Otherwise, nothing to do with this. Patient welfare was good. You were respectable. So everything was perfect, satisfactory, 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 and satisfactory. But the latent is a sleepy. So 15 by 16-year marks.
So symptom is
Do you
also
want to add
started.
anything? Symptoms, what I learned a few days before from the different examiners, they are not bothering about the if you are saying the symptoms or problems, they are not even bothering about that. I have discussed with the many examiners. They are currently even taking exams. So I ask, what do you think? The many candidates, they used to say symptoms are problem. He said it doesn't matter, but again, it depends on the surrogate to surrogate. The RCP criteria is not that strict with the surrogate and for the candidates. So symptom you can use, again, it's again depend on the surrogate to surrogate, station to station, center to center. Better if you want to say, the basic hidden agenda here was ability of the candidate to look for, is she or he is aware of about the latent tuberculosis, how to treat the latent tuberculosis, what are the side effects, what is the duration, is there need of any isolation or not, will this patient spread this disease to other or not, why this biologic cannot be started with the DMARS. So this was the hidden, questions from the examiner point of view. So you have addressed all these concern in a sympathetic and in a knowledgeable way. So I think you're not going to suffer anymore in this case. This case, by the way, faced by Dr. Asim yesterday. Okay, so there is a possibility you may face this case. Okay, very great job. There is no shakiness in your voice. There is no lack of confidence today, and you are trying to address the concerns. You are trying to
So
help
your
this
voice is
patient.
not
This
audible.
is the need of. My voice is not audible.
Hello,
Hello.
I'm Dr. Shahid, one of the doctors in the clinic. Am I speaking to Miss Sara, 22 years of age?
Yes, doctor. I'm Sarah.
Okay, so Miss Sara, we are here to discuss about your health condition. In the meanwhile, I will address your concerns. Would that be okay to you?
Okay, doctor.
Okay, so Miss Sara, being on the same page, may I know how much you know about your health condition?
Yes, doctor. Thank you for asking. And nobody's taking me serious. Actually, I'm having this bad, pain in my joints, and I have fatigue and body aches and the soreness in my mouth, which is killing me nowadays. And I'm suffering with this condition for a long time. And I have did a lot of investigation, and I was on the panel of the GP, and he gave a lot of medication also. But despite that, I was not getting well. So the last visit with your consultant, then he did some scans of my body and some blood test. And I am here today. I want to know what's going on with me, doctor. Why I'm having all these problems, and nobody's helping me at all. Please, doctor, help me. What's going on with me?
So, may I know what are your expectations from this meeting today?
Yeah, doctor, I want to know. I might have this condition known as a nose system SLE. I have gone through the internet and I'm reading that the problem, which is similar to this condition. I want to know, is that SLE or not?
Okay. So, Miss Sarah, I appreciate the knowledge you have regarding your health condition and the worries and with which problems you have been through since long time. So, Miss Sarah, yes, you are right that you have some tiredness, some joint pains, and some problem for the longer period of time, and for which you went through some tests, and the
Yes,
results are
doctor.
here in hand. Uh, so, Miss Sarah, it's a good news for you that all of your tests came out to be normal. Okay.
What do you mean, doctor? How could it be possible, doctor? I'm having a lot of problems, and All my tests, how could it possible, doctor?
Don't
Doctor,
worry,
I'm
Miss
not mad, doctor.
Sarah.
It's in my, you understand my suffering 6 months now already, doctor. I'm coming again and again. And then what's wrong with me, doctor?
Yes, Miss Sarah, your worries are valid, and I know with which stress you have been through since longer period of time. But Miss Sarah, sometimes it happens that a person do feel all these problems, the problems which you have been through, but the tests are all normal, and it shows that there is no underlying any illness going on in your body.
What do you
Are
mean,
you with
doctor, not
me,
having illness? Do you think I'm mad that I'm pretending? I'm making these symptoms by myself? What do
Miss
you mean,
Sarah?
doctor?
It, Miss Sarah, I appreciate your concerns, and it's not like that you are mad. Don't think like that. We are here to support you or help you in every aspect which will be
Nobody
required.
is taking my problem seriously, doctor. Today I'm here. I was thinking that you might be a specialist. You might take my condition seriously. And you are saying that everything is normal, that I don't have anything serious in my body. What it means, doctor?
Uh, Miss Sarah, I appreciate that you have all the concerns, and these concerns are valid as well. But sometimes there are conditions which are medically unexplained. Uh, do you want me to tell you more about it?
Tell me, doctor. Tell me, please. Help me, doctor. I'm here to take your
Okay,
help, please.
all right. All right. So, Miss Sarah, what happens that sometimes there are stressors in our life or some problems are going on which we do not recognize, but they causes some problem in our body. So what happens that our brain does not work in accordance with the bodily performance, and body shows all that stress in the form of fatigue, in the form of joint pains, in the form of fever which is not being documented, and a feeling of unwellness, though there is no underlying disease going on. So this is what is happening with you. Am I clear to you?
Yes, doctor. I'm tired, doctor, to listen the same things again and again. And you said that I don't have anything in my body. You cannot gauge my sufferings. Can you see my, soreness in my mouth, full of sores? Can you see my joints are stiff? It's not working. You know how it's difficult to cope with the normal daily life. I
I
have my kids.
understand.
I have my husband. I need to take care of them.
I
I cannot
understand it must.
cannot do the stuff which I was, doing 1 year before. I was very active.
I understand that this must be a difficult time for you to cope up with all these problems in your life. And
Then
don't
what's
worry,
going
we
on
are
with me,
here
doctor?
to help you out. So this is happening because your brain is not gauging the problems. Do you have any? May I ask a question from you, if you don't mind?
Yes, doctor, ask. But why you are talking about my brain? Do you think something is my brain?
Um, I appreciate that you have some concerns. Do you have any stressors in your life?
This is the biggest stress in my life, doctor. What's going on with me? And nobody's helping me. Nobody can identify what's the condition in my. Tell you, doctor, it might be a SLE, but you said that my tests are, are normal. No, you're giving me some information about my brain. Maybe I need some brain scan now.
No, no, no. Miss Sarah, it's not like that the way you are perceiving it. Don't worry, we are here to help you out in this regard. I know your sufferings are true, and you are in big problems right nowadays. But the good thing is that you are not being suffered from any underlying problem, and this is what happening that your body have some is not properly coping up with the situations with which you have been through for the longer period of time. So we are going to manage you, and we are going to help you out in every aspect. Do you want me how we're going to manage you?
Doctor, I think first you need to identify what's going on with me. Then there is management plan, right? If you say that
Yes,
I have
yes,
nothing in my body, then how are you going to help me? I think
yes,
better,
yes.
doctor, it's better for you to arrange a brain scan. I agree with you. There is something in my brain. Everyone is, Now assuming that I'm mad, I'm going mad, I'm pretending I don't want to work more. I'm tired from the life. It's not the case, doctor. I was very active. I was athlete in my, before marriage. I was the captain of my, football team. And all of this sudden, last 6 7 months is happening with me, and nobody's taking serious. And especially the doctors are they're not taking serious my condition.
Miss Sarah, it's not the way everyone knows you, and we are here to help you out in every aspect you want. So, what we are going to do, we are going to involve
Two
the
minutes
mood
left.
doctor here. We are
Oh,
going
oh,
to
oh,
involve
oh,
the
oh, oh. Mood doctor, doctor. I told you that you are considering me as a mad person. That's why you're going to involve the mood doctor now. Do you think
Miss Sarah.
I'm mad person? I'm visiting doctors again
Miss
and
Sarah,
again.
it's not like that.
Do you think I'm enjoying my life to visit the
Miss
doctors? Then why mood doctor?
Miss Sarah, it's not like that. It's not the way you are perceiving it. It's a mood doctor's duty is not only to prescribe medications. It helps in other way out as well. The way he will prescribe will guide you how to do the graded exercises, how to do mind exercising tasks, some therapies, and he will talk to you in a way to get to know the problem, the problem where the problem is going on, because all the tests are normal and your bodily habitus is normal, but the pain and the sufferings you have been through, we want you to be get out of it. We want you to be in a better state of health. We want you to be have our good well-being, and you enjoy life the way others are enjoying it, and to make it the task
Yes,
better the
doctor,
way
I understand.
you were
I
doing
want to
prior.
enjoy my life, doctor, like others. Please help me. Why you don't understand this, doctor? I want to enjoy my life like a healthy person. I was a healthy person. And you are
Yes,
involving
sir.
now mood doctor. Oh my God, doctor. I think you don't know what's going on with me, doctor. I need to go and at some other doctors now.
Yes, Sarah, it's right, but here we are giving you proper management, and we are here to help you out. In any time you need any help, we will provide you the hospital contact number, and we'll also provide you the brochures and
I'm up.
leaflets regarding this problem.
I'm up, Dr. Kurat.
Thank you so much. Thank you so much.
Thank you so much, Dr. Kurat. Sorry, Dr. Kurat, being a rude surrogate. And you might face the root surrogate, might be the surrogate will be hypothyroid if you will not give too much reactions. What do you think? What's went wrong in your case?
I don't know, sir. It was a difficult day.
Not a difficulty. You are enjoying the surrogate or not? Huh?
In the mid, it was very much hard for me to hold the laugh because I know the other person is surrogate. It's not a true patient, but in real life, if we encounter such kind of patient, it is very hard to cope up with that kind of situation. So it is this scenario is really hard to perform. Yes.
Okay, Dr. Kurat. It's very easy actually. If your opening was good, if you would, able to open the case in a good manner, the wording matters a lot here. And if you could draw a picture for me, okay, here, you can be a winner within a few minutes. Wallah. Okay, let's talk about how to approach this case. Let's see. These are the few lines, Dr. Kurat, which we need to mention while you enter the room. After introduction, you're going to open your case by these wording, these lines. You can modify the wordings, but you may say like this. Hello, my name is Dr. Kurat, one of the doctors in this facility. Am I talking with Miss Sara, 22 years old? Yes, doctor. We are here to discuss with you about your health conditions. Okay with you? Yes, doctor. Do you want anyone else to attend this meeting today? No, doctor, you can talk to me. Okay, Miss Sara, can you tell me how much you know so far about your condition? Miss Sara give you a lot of complaints and she's tired now. Do appreciate that surrogate. I highly appreciate your knowledge about your condition. I'm really very sorry about your sufferings. Okay. Oh, okay, Miss Sarah, can you tell me how you're feeling today? So just cool it down, calm down. This surrogate now. How you're feeling today? Yes, see, doctor, I'm feeling the same things which I'm feeling for the last 6 months now. Okay, what do you think? What's your expectation from today's meeting? Yes, doctor, I want to know what's going on with me. It's very difficult to live this life with these problems. Then, yes, Miss Sarah, yes, as you have mentioned that you have this problem, you're going to reread that card, what you have in your hands. Yes, you're right that you had a visit to our consultant, and he advised some blood tests and scans of your body. And I have received those scans and the blood test, and we have figured out your issue. Do mention Dr. Kurat here before jumping into that everything is clear. Just do mention we have figured out your problem. And the good news is that your all labs are normal. Now you're going to bring this surrogate towards your side. It means that you're suffering from some functional disorder rather than the structural diseases. It indicates that you have a condition known as IBS, functional lupus, okay, lower limb weakness, fibromyalgia. Put it as, in place of the IBS, everything. I put this only for example. Have you ever heard about that? This functional lupus, Miss Sarah? No. Do you want me to explain to you? Yes, doctor, explain me. What is this? Let me draw a picture for you. Dr. Kurat, you are going to draw a picture like this. Are you with me, Dr. Kurat, now?
Yes, sir, I'm here.
Yeah. Listen very carefully and practice this with your colleagues. So, Miss Sarah, here is our brain and here is our body. Our brain is connected to our different parts of the body. Here is our mouth, here is our hands, here is our legs, here is our tummy. And this brain is controlling the different function of our body. Okay. If there is any trigger, any hypersensitivity, ever any overactivity of these nerve cables, then it can cause a lot of problem similar to your condition, like soreness in your mouth, joint pain, fatigue, this one. It could be due to the many reasons, like stress, like lack of sleep, lack overwhelming life, okay, maybe some recent traumatic disorders, whatever you want to mention here. And I would like to know that, I want to know that, Miss Sarah, if there is any trigger in your case. No, doctor, I don't have any stress. I'm having good sleep. Sometimes, Miss Sarah, you are absolutely, sometimes there is a no trigger identifiable. Okay. But don't worry about that. Okay. We have, are you getting me, Miss Sarah? Now, now you're going to explain the condition, Dr. Kurat. Clear, Dr. Kurat, so far?
Yes, sir.
So, how you're going to cope this scenario? You are going to mention, I have received the reports and scans, and we have figured out your problem, first of all. And the good news, then you'll break a good news. The good news that the scans and blood tests are normal, that indicates that you have a functional disorder rather than the structural disorders. Have you, and it is known as a functional lupus because that's written in the scenario that patient is having functional lupus disorder, right? So how to pronounce
Yes,
this
sir.
diagnosis? So you should bring the surrogate into that direction. You should pull the surrogate towards that. Have you ever heard about that? No, no, doctor. Do you want me to explain to you? Yes, yes, doctor, please explain me. If you're not going to cope, if you're not going to handle this surrogate in these few lines, surrogate is going to give you some tough times similar like you had today a surrogate. So you're going to draw picture. So here is the brain, here are different part of the body. These are connected with the nerve cables, and it's controlling the different part of the body. If sometimes they become overactive or hyperactive, then due to many reasons. and they can cause a lot of problems similar to your condition. This is a real condition, Miss Sarah. I understand your worries, and we have a very good management plan for you. Okay, come to that point. Lifestyle modification, copic graded exercises, and I'm going to involve the mood doctor. Whenever you are going to highlight the mood doctor, the surrogate is going to cry on you, shout on you. What doctor? What do you mean by mood doctor? Do you think I'm a mad person? No, Miss Sarah is not like that. I'm really very sorry if you perceive like this. Mood doctor is the best doctor in such situations. Okay, he's a specialist for such cases. You need to highlight the mood doctor is the specialist doctor for such conditions. Okay, he will sit with you. Okay, he will identify the trigger in your case and he will help you not only by the medications. They have a different treatment plans options. If they will not work, of course we will escalate the treatment. They might give you some medications. Is that okay with you, doctor? Miss Sarah? But doctor, yes, he is the best doctor. Now you're going to highlight the mood doctor is a part of our team. He is the best doctor in such situations. What is the task of the mood doctor? He is not only for the mad peoples. He is the specialist to identify the triggers in your case. Nobody's understanding my suffering, doctor. You are all the same. No, no, Miss Sarah, it's not like that. You're suffering a true suffering. I can understand. I understand your worries. We are here to help you and support you. I will not let you alone. I will be with you throughout your journey. Of course, it will take time, but don't worry about that. We will take care of you. We will monitor your condition very closely. Do you want me to explain to you what treatment plan we have for you? Yes, yes, please. Then you are going to say lifestyle modification, good nursing care, healthy food, daily exercise, relaxing therapies, coping strategies, pacing graded exercises. Okay. Here, Dr. Kurat, she might give you a concern. Doctor, if I'm going to take this medicine, will I get better? Because I'm planning to travel with my family after 20 days to Australia. Will I be able to travel or not? How you're going to address this concern?
Sir, can you please repeat it?
Patient want to travel after 20 days.
Okay.
Will you allow this patient to travel or not?
Yes, you can travel because your underlying condition will not going to hamper your traveling, and the
Mhm,
medications or any treatment plan provided to you by the mood specialist doctor will
mhm.
going to be a different perspective. It will not harm your journey or any traveling at any kind of uh,
Okay. Okay.
plan for
So,
you.
okay, if the case is IBS, are you going to let him go? No. So, again, diplomatic statement. Yes, Miss Sarah, it's good to know that you are traveling, you are planning a travel with your family. But I'm really very sorry to tell you that it's very early to say. It depends on your response to the treatment. We will monitor your condition if you will be eligible, if you will be okay that time, and we will let you know. Are you getting me, Dr. Kurat, now?
Yes, sir.
So be a diplomatic here. Help, help, but in a diplomatic way. Yes, yes. It's good to know, Miss Sarah, that you are planning to travel with your family. But Miss Sarah, I'm really very sorry to tell you that it all depends on your response to the treatment. But don't worry about that. We will keep you monitoring your condition. If you will be there, you will be fine. Okay, then we will see and we will evaluate you. If you're eligible, of course you can travel. But it's very early to say. Now again, diplomacy and diplomacy. How that sounds to you? But doctor, believe me, Miss Sarah, I'm here to help you and support you. I will be with you throughout our journey, and we will not let you alone. Okay, don't worry about that. This is a real problem. I understand that you are suffering. You are suffering a lot, but believe me, your condition will be improved. So you are going to close this. Now I'm going to share with the brochure and leaflet about this condition to read more about to understand this condition. I'm going to share with you hospital number if you have any new problem, safety netting. If you have developed any new problem, please contact us. Please come to us immediately. Okay, we will address your concern. We will help you. Don't worry about that. I am Dr. Kurat here. I am 24/7 on your panel. Just call me. I will be there. Okay, Dr. Kurat.
Yes, thank you.
Now you have an idea how to approach this case.
Yes, sir. Sir, the way I approach, beside the few problems which mistakes which you pointed out, how much marks you are going to give me?
Dr. Kurat, actually, the problem is that you did mention that you don't have anything. Okay. So if you are going to say like you don't have anything, the surrogate is not going to give you a safe pathway to move forward. So you
Okay,
will not yeah, even you are going to involve the mood doctor, but you don't have a defensive mechanism how to defend this concern. Mood doctor, of course, you are going to show a lighter to the fire. Do you think I'm a mad? No, no, don't Miss Sarah, not like that. Mood doctor is a specialist in this case. He's a part of our team. We will take care of you. We'll sit together. We will identify the trigger in your case. As I have mentioned, there are a lot of triggers. Okay, we will plan accordingly. If there is no help, uh, if there is not helpful, then we might consider you some on medication. But don't worry about that for temporary. So in this way, you are going to approach this case. If you could draw here, if you could just change the statement, we have figured out your problem. But you have said you don't have anything. You don't have any disease. Am I right or not?
okay, sir. Okay,
The functional disorder is a disorder. In medical sciences, there is a functional lupus, there is a functional IBS. So you should highlight that this is a functional disorder. Brain is connected to the different part of the body. You need to draw. As long as you are going to draw, Dr. Kurat, wallah, you are going to get 16 marks. This is a scenario where you can get maximum marks because 3, 4 trigger areas, you are going to touch those areas and the examiner is going to give you 100% marks. The first thing is that you are going to break bad news in a good way. We have figured out your problem. Doctor, do you think nobody's taking me serious? Don't worry about that, Miss Sarah. Your problem a real problem, and I'm here to help you and support you. Don't worry about that. You have a condition known as functional lupus. Have you ever heard about? No, no, no. Would you like me to explain? Yes. Let me draw a picture for you. Here is the brain. Here is the different part of the body. Hypersensitivity of the nerve cables, causing a lot of problems, similar to your condition. So you are going to give a disease process now, like SLE, like MS, like adult polycystic kidney disease. You're explaining the etiologies, clinical symptom and signs, complications. Similarly, you bring this case as a functional disorder in this way. This is a functional disorder. There's a functional neurological disorder. There's a medically proven diagnosis. We understand your sufferings. These are the real sufferings. Clear, Dr. Kurat? Don't take
yes,
it.
sir.
Don't take it personal, Dr. Kurat. You're not my
No, no,
enemy.
no, I'm not taking it. No, no, no. I'm not taking it personally, but I was just asking.
Or I can listen your gasping. You, oh, why Doctor Azhar? Why Doctor Azhar?
No, sir, it's not like that.
So, dear doctors, this is a case, real case. So, I have faced this case. Wallah, I have faced this. My examination case was a functional disorder, and my score was 16 by 16. I have followed the same scheme, similar scheme. Wallah, not even less, not more. Don't worry about that, Mr. XYZ. I'm here to help your support. We have figured out your problem. Your test is normal. And doctor, why your my tests are normal? Let me draw a picture for you, maybe for the better understanding. There is a real problem you are suffering from. Here is our brain. Here is a different part of the body. Sometimes there is a hyperfunctioning, hyperactivity of the nerve cables, and it can cause a lot of problems. Similar to your condition. Again, same story, diplomacy. But doctor, why mood doctor? Mood doctor is the best doctor. He's a specialist in such situations. He's a part of our team. Okay, we will not let you alone. We will manage your condition. Okay, throughout your journey, I'm with you. Don't worry about that. But mood doctor, he is for the bad people. No, 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 it's not like that. Sorry for if I give you some kind of perceptions. No, it's not like that. He is the best doctor in such situation. Just highlight, just appreciate the mood doctor and take the mood doctor in your team. Then the surrogate will be very happy that he knows how to handle this situation. Clear, doctors? We have a good management plan for you. Good nursing care, sleep hygiene, physiotherapy, daily exercise, change the lifestyle, change diet, graded exercises, coping strategies. These are the treatment plan for all these categories, dear doctors. Fibromyalgia, IBS, functional lupus, functional lower limb weakness. There are 5, 6, 7 cases of functional. Same approach, same diplomacy, and same marking criteria 16 by 16. Am I clear, doctors? Any question from anyone? Dr. Muhammad,
No question, sir.
clear?
Yes, sir.
Okay. Dr. Walid, do you have any question?
No, doctor.